One of the things that we've had to deal with together over the last 12 months is rehabbing a second ACL. So when you're approaching someone who's rehabbing their second ACL, is there anything that you think about or do differently from someone who's had their first injury?
Yeah, it's interesting because obviously the one thing that I found very, very interesting in this rehab in particular is how quiet the knee was compared to a fresh ACL. So the second injuries happened, and the athlete obviously, we assessed the athlete, and a few days later, their knee was really functioning quite well compared to, this is the person who's had, the second ACL compared to, say, a fresh ACL. They get the bigger fusion, pain, stiffness. So I think from a second ACL perspective, I was really surprised with how much prehab we could get into them, like good quality prehab, compared to obviously the first ACL where we're just trying to really get extension and settle the knee down. In terms of towards the end stage, I would definitely, everything would be objective, but I would just be adding time in terms of the exposure to how many reps they get when they start getting back into team training. I think there can be a lot of psychological trauma that comes and stigma that comes with a second ACL. And I think that there's no real reason to rush that process. So if, for example, someone's, so you're going to give someone, 4 weeks of full team training after their first ACL at the back end. You might consider giving them the second ACL, 6 weeks, etc. Or you might spend a little bit longer when they first integrate into team skills. And I think that also depends on the mechanism as well. Like if the second ACL was a contact mechanism, you might not change too much. The second ACL is a clear non-contact mechanism, catastrophic sort of knee injury, then you obviously might spend a little bit more time on, stepping movements or your biomechanical work.